Yeah, but isn't that a first step of the good intention, well intended by this bill?
No, I think it's only intended to create even more havoc. Because when you do that, when you introduce that everybody should treat an emergency, that's fine. Now, you set up a fund, an emergency fund, whereby you say, okay, we will get HMOs who will underwrite maybe 100,000 patients.
And everything has to be spelled out in the bill?
It has to be spelled out to the extent that there has to be an emergency response fund.
Because we spoke to a public health professional a couple of days ago, and
Yes.
he said that one of the good things about this bill is the fact that it provides a special fund, not just for emergencies, but also because primary healthcare centers can have a fund, the states will have a fund, the federal government will also have a fund, and this bill provides money, the much needed money that the health sector needs to run.
Well, I can take up an issue with that, but just to bring clarification to the issue of the emergency, when you spell out in a law, you have to name it. That this is an emergency fund which you apply to. Don't worry, if you treat the patient and you are not compensated for it, you can apply through this emergency fund. It has to be mentioned and it has to be created, where that money will come from and what the process is. It might not spell out all the details, but actually it has to be mentioned and provision has to be made for it. When it comes to providing money, which is what they have been highlighting, the problem in Nigeria has been that it's not the money, it's just that we have this murder corruption that actually swallows everything we do. Now, even writing it in a bill and saying now we have a primary health fund will not change much. Because if you go to the states, I know in Imo State and everywhere, you will see a whole litter of well-built primary healthcare centers which are overgrown by weeds. Why? Because there is no doctor. And we are telling them, let our private practitioners around go to their small, even houses. You will see patients coming to those places. Why don't you allow these private practitioners to run these primary healthcare centers?
Interesting.
And provide services to the people?